Greetings, good people, beautiful people. Welcome to Kalami Royalty, the podcast. I am your host, Mihle Chiba. Welcome to episode 7 of season 1. Yes, we are now on episode 7. It's been 7 weeks, good people. And if this is the first time listening to the podcast, welcome. This is a mental health awareness podcast that aims at breaking the stigma on and discrimination of mental health in South Africa, especially in small Black communities. And if it's not your first time listening in, welcome back. So today we'll be talking about mental health and COVID-19. So we all know how COVID-19 has affected a lot of us. It has affected us drastically. We've lost loved ones. Some lost their jobs. Some got sick and seriously ill, actually, because of the COVID-19. So before I begin, I would like to explain what COVID-19 is to those who may not know. So coronavirus or corona disease is an infectious disease caused by the SARS-CoV-2 virus. Most people who fall sick with COVID-19 will experience mild to moderate symptoms and recover without special treatment. However, some will become seriously ill and require medical attention. And we all know that COVID-19 can also lead to death. So here's how it spreads. The virus can spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, sing, or breathe. These particles range from larger respiratory droplets to smaller aerosols. You can be infected by breathing in the virus if you are near someone who has COVID-19 or by touching a contaminated surface and then rub your eyes or touch your nose or your mouth. The virus spreads more easily indoors and in crowded settings. So you need to make sure that you sanitize your hands, you wash your hands with soap or sanitize them regularly. Wear a mask if you're in a public place. Keep social distancing, and try to avoid crowded places. Okay, but you can go outside for fresh air, not in a crowded place, but you can go outside to get a fresh air and avoid being indoors all the time. So COVID-19 and mental health. So COVID-19 has had a significant impact on mental health. Found that adults who had experienced childhood trauma and other related adversities were at higher risk of developing depressive symptoms precipitated by the perceived risk of contracting COVID-19. COVID-19 may also lead to mental health presentations such as post-traumatic stress disorder, mood disorders, anxiety disorders, phobias, and obsessive compulsive disorders. Now, I've been doing a research and especially about how COVID-19 has affected South Africans. About 33% of South Africans were depressed, while 45% were fearful and 29% were experiencing loneliness during the first lockdown period. While the provision of and access to essential services, including mental health care, was permitted during the lockdown period by the government, some mental care users were unable to access services due to limitations and risk presented by physical contact and in-person consultations. Furthermore, in number of patients who defaulted their psychotherapy appointments was higher than usual during the initial stages of the lockdown period. Some of the reasons cited by patients were fear and anxiety about contracting the virus, or transport difficulties, retrenchment, and unemployment. Furthermore, several patients who attended their psychotherapy sessions reported secondary impact of coronavirus or coronavirus pandemic, such as sleep disturbance, anxiety, depression symptoms, unemployment, food insecurity, substance withdrawal symptoms, and intensified abuse in their homes. The mental health care challenges were not only limited to outpatients, but were also applicable to inpatients. Although there is no recorded data on patient incident among patients in state or provincial long-term care facilities during the lockdown period, personal observation during clinical practice suggested that there was an increase in patient accident report for various reasons, including irritability resulting from the inability to access tobacco due to lockdown regulations, discontinuation of patient visit and leaves of absence, and psychological distress. So I mentioned that COVID-19 can also cause death. We all know that a lot of people lost their loved ones because of COVID-19, and our thoughts go out to the family members who have already lost loved ones to coronavirus. Even if you have not been directly impacted by COVID-19, there's no question that this is impacting the mental health of many of us. We are seeing lots of people on social media discussing ukuthi coronavirus is making their symptoms of anxiety or depression worse. So imagine if someone passed away, a loved one has passed away. When you are grieving, your mental and emotional bandwidth are already strained. Adding external stress and instability can be even harder to cope with, and then it would be otherwise. From anxiety about the illness itself, to concern about social isolation and reassuring children, we know that this can be a complicated and overwhelming time. Ukunakekela your mental health during coronavirus pandemic is especially important. First and foremost, give yourself permission to acknowledge and feel whatever this is bringing up for you, and communicate that with your support system. Think through who might be the best to support you in whatever you're experiencing, whether that is needing help with practical and logical issues, to just needed someone to talk and express concerns to. So we all know that everyone reacts differently to stressful situations. The emotional impact of an emergency on a person can depend on a person's characteristics and experiences. The social and economic circumstances of the person and their community, and the availability of local resources. People can become more distressed if they see repeated images or hear repeated reports about the outbreak in the media. People who may respond more strongly to the stress of a crisis include people who have pre-existing mental health conditions, including problems with substance use. Children can be stressed. People who are helping with the response to COVID-19, like doctors and other healthcare providers or first responders can find themselves experiencing stress. So reactions during an infectious disease outbreak can include fear and worry about your own health status and that of your loved ones who have been exposed to COVID-19. There will be changes in sleep or eating patterns, difficulties sleeping or concentrating, worsening of chronic health problems, increased use of alcohol, tobacco, or other drugs. My advice to people with pre-existing mental health conditions, they should continue with their treatment plans during an emergency and monitor for any new symptoms. Coping with these feelings and getting help when you need it will help you, your family, and your community recover from a disaster. Connect with family, friends, and others in your community. Take care of yourself and each other, and know when and how to seek help. You can call your healthcare provider if stress reactions interfere with your daily activities from days in a row. So things you can do to support yourself during this pandemic. Avoid excessive exposure to media coverage of COVID-19. You need to take care of your body, take deep breaths, stretch or meditate. Try to eat healthy, a well-balanced meal. Exercise regularly, get plenty of sleep, and please do avoid alcohol and drugs. You need to make sure to unwind and remind yourself that strong feelings will fade. Take breaks when watching or reading or listening to news stories. It can be upsetting to hear about the crisis and see images repeatedly. Try to do some other activities you enjoy to return to your normal life. You can connect with others, share your concerns and how you feel with your friends or family members. Maintain a healthy relationship. Maintain a sense of hope and positive thinking. So for parents, I know people will feel like children are not affected by this, or would react in a certain way because of COVID-19. But children react in part on what they see from the adult around them. When parents and caregivers deal with COVID-19 calmly and confidently, they can provide the best support for their children. Parents can be more reassuring to others around them, especially children, if they are better prepared. So not all children respond to stress in the same way. Some common changes to watch out in children are if your child has excessive crying and irritation, returning to behaviors they have outgrown, like toileting accidents or bedwetting, excessive worry or sadness, unhealthy eating or sleeping habits, irritability and acting out behaviors. You might want to watch out for poor school performance, or if they avoid school altogether. Difficulty to concentrate and pay attention. Children may avoid some activities they enjoyed in the past. Unexplained headaches or body aches. With teenagers, you might want to look out for use of alcohol, tobacco, or other drugs. There are things you can do to support your child, like take time to talk with your child about COVID-19 outbreak, answer questions and share facts about COVID-19 in a way that your child can understand. Reassure your child that